I used to do work as a nursery nurse before, and I spent some time doing some voluntary work with children with HIV and AIDS, and I suppose it made me think about doing the nursing side of it, having worked with volunteers in Romania who were nurses, and I had a passion for caring for children, special sick children. I've been told from a few people that Salford's the place to do your training, that it's a really good place for nursing, and it was just from feedback from other people that that's what I chose. The placement I went to was it's with a charity called Children in Distress, which is a British run charity, originally by a Reverend John Walmsley, who had this vision to help children in Romania that had been orphaned with HIV and AIDS. So I decided to return there to Romania, to a hospice called St Andrews. So I worked over 3 different hospices, St Andrews, which is in Pitești, St Margaret's, which is in Bucharest, at the capital, and St Lawrence Children's Hospice, which is the hospice that basically is run for children with HIV and AIDS. The other 2 hospices that I work with were children with special needs, life-limiting illnesses, hydrocephalus as well, which is not treated and not operated on in Romania. So that's basically where my work was, and I spent 4 weeks over the 3 hospices. I think I really wanted to go back as a nearly qualified nurse, just to see what the differences are being a carer and as a student nurse, and working with the qualified staff in Romania. I wanted to see what the difference is, the way they care for the children, how they work as qualified staff, and do a comparison really of how it is in England really. On the other hand, it was also a passion of mine to go back and see how much I'd progressed really as a person, how much I'd learned during my course and how much I could give to the children really. So it's a bit of both, and it's also to make people aware of the NHS system really, and the differences between Romania, Eastern Europe and England really. So there's quite a few reasons that I felt would be right to go. As part of the international placement, what they ask you to do is to organise everything yourself, and that including finding your placement, your accommodation, and to look for a place that obviously they were going to support you as a student. So having worked out there before with the charity, I knew that I could trust the charity as being a safe charity to work with. The support I got while I was here was basically students. We did a lot of blogging, so I would write a diary each day, and people would reply to it. So it was my way of communicating with fellow students, just supporting one another in that sense. They were very helpful over there. Obviously, they met me at the airport. They helped organise accommodation, transport between each hospice as well, and food was provided. Everything was all pre-planned so that I knew what was going to happen when I got there. I think it made an amazing difference, because sometimes when you're doing your studying, you feel so that everything's not going right. You're struggling to get through. You feel like you're not learning a lot. I think it's because everything's so technical, and there's a lot of paperwork involved in nursing these days, that going out to Romania brought back basic nursing. And it was not about writing hundreds of documents, and there were no equipment at all. So even doing a temperature, it was all based on looking at a child and making sure you knew that you thought that child had a temperature. Otherwise you would never know. It's all about learning about basic nursing care and getting back to that. And I thought that's something that I really needed to do, because I think you can rely on your equipment, on knowledge from books, but it's all about getting back out there and looking at your patient. And it just reminded me of what nursing was all about. It's not just about targets and pushing to get people out of the ward and back into the community. It's about compassion, and it's about love, and giving it 100%, whether you've got equipment or whether you've got the money or not. And sometimes I feel that people mock the NHS, and I came back thinking, you know, we've got so much that other people don't have, and we still give really good nursing care. So that's really what it meant to me.